Hi everybody. Clinical depression is more than just being sad. Now we can all feel sadness from time to time and quite easily get over that sadness. So clinical depression, there is more to it. Many people suffering with depression worldwide. It's quite common. It's one of the most common illnesses. Um, Forms of it could be mild, moderate, or severe. Symptoms. The symptoms of clinical depression is feeling worthless, low self-esteem, low mood, affecting your mood, motivation, not being able to function properly, affecting your day-to-day task, and even as well interest, lacking in interest of the things you once enjoyed doing, people once enjoyed doing before they become depressed. There's a lot to it, affecting sleep, poor appetite. So affecting affecting emotions, your feelings, your behaviour there, and also as well even socially disconnecting from other people because of how you're feeling. Also as well physically, sometimes it can affect you physically, like fatigue, feeling very fatigued, your muscles, pains and aches in your muscles, the tension going through your body. Some people as well even experience anxiety with it. So clinical depression is quite common and it's serious. Many people may try to cope with it themselves, but the more it's prolonged, the more harder it gets. Some people find it hard to just try to cope with it, just wanting that sense of relief, just wanting that relief of how they're feeling. So there's how your behaviour towards it, towards how you cope with it, could be good or it could be bad. Bad as in wanting that quick release of how you're feeling because you feel so much overwhelmed maybe, and not being in despair and not being able to cope properly and just wanting to get out of how you're feeling, just a bit of relief. And sometimes some people it could be having a drink, alcohol. So having alcohol, it will give you that sense of relief. It gives you a sense of relief at first, but it's short-lived, and many people fall into that trap because of getting that sense of relief. The more it's done, it turns into a habit, and sometimes it can become more serious. What's happening is it's making it even more difficult then to cope with. The symptoms become more difficult to cope with, and many people, unfortunately, because of it, because of being in that situation, thoughts, it goes to your emotions, how you're feeling, thoughts. Alcohol is a depressant, so the mixture there of how you're feeling, the balanced chemical, the brain, the nerve chemical that affects our mood. Alcohol affects our mood anyway. It can make you, some people, it can make you feel low in mood anyway, or it can make you feel agitated. Alcohol can, so that clash there is just bringing it to the forefront, making it even more difficult to cope with over a period of time. And some people, like some people have had suicide thoughts, or even tried or took their own lives, which is quite sad. And we have to realise that nobody wants to be in that predicament there. And remember, when you're in the throes of that depression, when you're in the throes of that despair, those difficult moments, you just can't see beyond that. That's what happens. You can't see beyond that, how you're feeling, that there is good beyond it. There is a solution beyond that, which is good, that it's going to help you, enable you to cope with it in a better way, in a more positive way, and get you through it, and get you through into a recovery, because there is recovery, a full recovery. Many people make full recoveries with depression. So I just want to send out a message before I carry on. Anybody in that, if you know anybody that is fallen into that trap, just be there and give them that support and encouragement and hope that beyond how they're feeling, there is good. There is good, and there is a positive way that you can help with them, to help to recover and get them out of how they're feeling in a beneficial way, like going towards the good, which is reaching out, encouraging somebody just to reach out. That's your first steps. Reach out and talk to somebody if you're feeling in that situation. If you feel you've got those symptoms and it's been prolonging, or if you're in a trap of, like what I've just said, this is a way that you can do it by reaching out. So this video, I wanted to do that at first, just to do the explaining about it. So this video is about treatments that can help you, and what you can do for yourself that can help you with it and get you through into a recovery stage and recover and get you, you can fully recover, like I said, from it. So first of all, treatments for it. Talking therapies, it may be hard, when you're, like I said, when someone is depressed, it's not that easy to, at first, to just talk about it, but it's beneficial talking about it. So first of all, taking those first steps, reaching out to somebody and talking to somebody, friend, family, seeing a doctor, to see, and then talking therapies, having those treatments will enable you to start within yourself with your feelings and them emotions, being able to, giving you that ability then, headspace, to put away from feeling overwhelmed as well, and will give you that headspace to be able to process your emotions of what is going on within yourself, those emotions, those difficult emotions, and what the symptoms are of how it's like affecting you, being able to process it in a better way, being able to then cope with it in a better way. These things take time. It's not an overnight thing that's going to work straight away. Talking about it is a gradual process, but it will eventually give you that ability to be able to process those feelings, those emotions in a better way, process your symptoms in a better way, and enable you to cope with it in a better way. So as you're talking, some people may be offered medication like antidepressants, but just having the tablets, the antidepressants, you need that talking therapy alongside it to work with it, so it creates a balance there, getting back that balance there of how the balance. Other things as well, it's very important to try to build back on doing things like self-help care for yourself. It's very important. It will, it's very good for depression, self-help care, the talking treatments, medication if you're offered medication, and self-help care is very important. It's very beneficial to enable you to make a full recovery. Now, self-help care, exercise is very important, and it's very good for depression. It's good for mental health problems, in mental health or well-being in general, but exercise will help with that balance, releasing them endorphins, the chemicals that gives you that natural high and gives you that contentment there, and gives you that contentment there. And also as well will gradually make you feel a bit more positive within yourself, because there's a lot of negative going around with depression. So it gradually focuses you towards being a bit more positive. Exercise, it would also as well, motivation. Now when you're feeling like that, motivation is very hard to go and do that exercise, understandable, but sometimes you really, and I have to say this, even though it's really hard, you really have to push yourself. I know it's easier, you may be thinking it's easy for me to say, but I've been in that predicament. I myself have had depression and pulled through it. I had just a mild form, but depression is depression. I lost interest in things that I liked doing, but once I got on that start of getting that help, talking about it, it gave me that ability to think beyond how I was feeling. It gave me that ability to be able to process it better, and it started to give me that motivation, and like I said, that ability to look beyond how I was feeling and see there's something good there that's going to help me. And that's what you've got to hold on to that hope, and hold on to that to enable you to get you motivated. So help with your motivation, exercise, your low self-esteem as well. So exercise is very good as well. Building back on your appetite, because sometimes your appetite may go poor because of it, and building back that appetite to having nutrition, a healthy diet. Food will help with your mood, how you're feeling, give you a boost in your mood. It will help with your energy. It helps physically how you're feeling as well. So building back on your appetite, sleep as well. Sometimes you may have poor sleep, or you may sleep too much, or you may not have enough sleep. It depends. Depression affects people differently. Each person, or some people may be affected differently with it, but sleep, building back on the right amount of sleep is very important. So before you go to bed, getting a routine balance there with your sleep in the evening before you go to bed, to help you feel more relaxed. Maybe have a hot bath to help you feel more relaxed, help you feel more relaxed with your body and your mind. Even practice some mindfulness. Mindfulness is very good. It will help give you that ability as well, the same way, to process those emotions and feelings and your thoughts better. So mindfulness will help you feel calm, relaxed. So maybe practice doing some meditation, a bit of meditation before you go to sleep to help with that, to help you get that sleep. If you're having difficulty, if you're maybe sleeping too much, sleeping in a bit too much, maybe investing in, if you haven't already, to get you back into that routine habit of getting the right amount of sleep that's going to benefit you. An alarm clock, having an alarm clock and setting it for a certain time in the morning to get you back into that routine, that rhythm of that pattern again, because rest is important. Rest helps us to heal. So rest, getting that right amount of rest is very important. So building back on your sleep, it's all about like what you can do to help it. But just remember, it takes time. It's not something that's going to work overnight. But the more you do these things, once you start to get into taking those first steps of talking, having those talking therapies and whatever else, and then building back on your self-help care along with it, eventually you will start to see that benefit and start to get more confident within yourself. Everybody's different in how long it takes to heal. Some are quicker than others, but it's time. Healing is time. It's patience as well. And like I said, with clinical depression, it is important to have treatment for, get those right treatments, and self-help care is very important. Like I said, not all the time we go straight to being able to take those first steps. Sometimes it just doesn't work like that, but in reality, if it's prolonged, it just gets harder and harder to deal with at the same time. So this video really as well is encouraging people out there, if they're suffering with those symptoms that have been prolonged, been going on for a certain amount of time, like over 2 weeks, longer, my advice would be to reach out to somebody and talk to somebody, see a doctor, and get your recovery, start your recovery, because there is full recovery with depression. And also as well, I would want to state as well, because even after recovery, once you start to feel better, it's all important to keep a routine, to keep on track with your well-being, which will help carry on, because we quite easily think, well, I feel better now, I don't really need to do that or that. It's very important to keep on track with your routine after recovery, not just throughout recovery of having depression. Keep it up, and it will help keep your well-being good as well. So I'm going to end the video there. Please share this video, because it is very important. There are many people that suffer with clinical depression, affecting them different ways, brought on by life events. Could be bereavement, it could be prolonged stressful situations, difficult situations, overworked. It could be brought on by anything that's like caused somebody to feel like that. It's like trauma to the brain, trauma to the mind. It can only take so much. We say about stress, you know, some stress is good for us, but too much is not that good, and it needs to be addressed, you know. So please share this video. It's very important, you know. Mental health is very important, just as important as physical health as well. And don't forget to give us a like, and if you wish to subscribe to my channel, feel free to. If you've got any questions or if you want to leave a comment, please do, and I'll do my best to answer the questions for you, you know, answer them for you. All I could do is just, I do these videos to, if I could help one person, it would be good. If I could help more, it would be even better, you know. So I'm going to end the video there and see you in the next video.